Our Soteria house that we opened in Bradford in UK from 2014 to 2015, the principles that we held on to were not using diagnoses, people that we chose to work there, not because of their paper qualifications necessarily, but because of their ability to sit with people in distress, be with their distress, which sounds very easy, but it isn't always. For people, they're part of the team, not coming to fix things, to do to someone, but to spend time with that person, either talking or not talking, because sometimes people just need to be quiet, but to know that there's someone with them. We didn't use diagnoses. People had a choice as to whether they took medication or not. We weren't anti-medication, but we wanted to provide a safe place for people that didn't want to use medication or wanted to safely reduce their medication. The place was a safe space where people could come. There were no locked doors. People could come and go as they pleased. And the role of the team supporting them was to be with them and to do what they wanted to do. And some of the things that came out of it were that people said just being with other people that were doing everyday regular things helped them just to join in again and start doing not amazing things, just everyday things, being with someone and just doing a bit of washing up. For some people was very healing, just to feel that they were there, they were doing things and they felt safe. It sounds very simple, it isn't simple, but it can work and it can make an amazing difference to people. People were again always treated with respect. They were given time to come through whatever they wanted to go through. We had other people that weren't working in the house, but they were kind of around the outside of it. So if they needed additional support or they wanted people to work with them and their family, then that was part of it too. If they needed time to or someone else to work with their family to help them understand better what was going on. And they stayed there for between 6 months and a year. And in terms of things that we've learned or that I think we could have improved on, done better on, was to, we did have some good allies in the local mental health system. But I think at the time, because there wasn't in the UK as much known about Soteria, I think we were probably a little bit too cautious at trying to not work with those allies as much as we could have done. And I think if we'd spent more time working with those allies, we may have been able to continue more than the year that we worked with. That's just one of the thoughts. And I think if we'd had funding from more than one source, I think we would have been able to carry on longer. So it was about forward planning. We set it up as a pilot project to prove that it worked, and we did do that. And I think there's still a lot that we've learned from that we're going to put into the houses we're opening now.